COVID-19 is devastating health systems worldwide. Hospitals are often understaffed, doctors and nurses overworked, many without life-saving protective equipment.
We are completely overflowed. Health workers are exhausted, physically and emotionally, because this is awful. This is an inferno.
And after a grueling shift, it doesn't end there. Some are isolating themselves from their families, returning home from work, forced to keep their distance from partners and children. Some compare it to life in a war zone.
We are scared. We're trying to fight for everyone else's life, but we're also fighting for our lives as well, because we're also at the highest risk of exposure. It's tough. And many shifts that I've left from, after finishing my shift, I've cried.
I had headaches every single day. Before going into night shift, I was having like chest palpitations, chest pressure, just from like the anxiety and fear of like what was coming.
Some doctors and nurses are being threatened with dismissal for speaking out against working conditions and the lack of protective equipment, such as face masks and proper gowns. After 17 years treating patients at a hospital in the US state of Washington, a doctor says he was fired for publicly criticizing his workplace and the lack of safety measures for staff.
I do feel they're feeling the pressure from the press. I do feel they're feeling the pressure from social media and the community. But I don't really feel they fully comprehend the potential damage to healthcare workers.
While his employer has denied his sacking, the incident highlights similar cases. As medical and emergency workers rush to save lives, many are updating their wills and funeral plans too. Sarah Khairat, Al Jazeera.